Okay, welcome everyone for another episode of the podcast. Today we have a special guest. Today we have Dr. Lee. Um, Thank you so much for joining us today and like taking time out of your day to talk about peptides and everything cool about peptides. This all started really from us seeing a lot of injuries and MMA athletes and even jujitsu players and like athletes, and we noticed that they were on peptides. I was like, oh, that's cool. And then I actually had a bad injury last year, and I actually tore part of my cartilage behind my kneecap and part of my quad tendon. And I was struggling for the first week, and it was pretty tense. It was the first time in my life where I had the knee pain where I was like, okay, it's not going away with rest. I had some buddies who were on peptides, and I hopped on some peptides, specifically BBC 157. In 1 week, I had full range of motion, healed so well, and I could start my rehab process. So that's what started all this interest in peptides. And then you start looking around Orlando, like, okay, who's the expert on peptides? And everyone kept on pointing to you. So it's a blessing to have you on. And thanks again for taking time out of your day for that. We're going to put an intro to your bio and everything in the description below, but you can start us off basically. What are peptides and where do they come from?
Sure, Ron. By the way, I wrote a book on peptides, so a lot of the information that we're going to be discussing is actually in the book. But let me show you the picture of the book, and it's called The Fountain of Youth with Peptides. And
Love the
anyway,
title. Love the title.
so you can get it through my office or through Amazon. This is the electronic copy of it, but the hardcover copy is only sold in my office. You can't get the hardcover copy through
Nice.
Amazon. So anyway, peptides are, like I tell my patients all day, they're small little proteins. They're made of the same thing with proteins, amino acids, and we have 20 different amino acids. So if you link up 20 different amino acids, you have a peptide. A peptide could be 2 amino acid long. It could be, 10 amino acids, but in general, it used to be like over 100 was considered protein and under 100 a peptide. But the FDA arbitrary drew a line in the sand and said under 40. And it's not based on science. It's
Yeah.
anyway, they just drew that line in the sand. And anyway, so most peptides are generally small, but there are some peptides in the 45 amino acid range. But anyway, peptides are really like signaling molecules. They like for your injury, when you use BPC, it helped you recover faster because it rang the doorbell of your body to help your immune system to heal it. So it turned on certain production of your fibroblast cells to make more type 1 collagen. So it can heal those micro tears. It can help with the blood flow. So you have better circulation to that area. It also can help with the neural damage, the nerves that are damaged. So it can basically help with the lining of the nerve, the myelin sheath. So BPC 157 is nicknamed as well, I'll tell you the nickname, but what it stands for is Body Protection Compound 157, and it's nicknamed as the Wolverine peptide.
That's a
So
great name for it, like superhuman healing powers. I
yeah,
love that.
so yeah, yeah, so you probably watched the Avengers and all that,
Yeah,
and
Avengers and X-Men. That's awesome. I'm gonna start
yeah.
using that. So you and the Wolverine peptide. Nice. So where do peptides come from? I get that question a lot whenever I start talking about it. And someone asked me, I was like, that's a good question. I know they're made in a compound pharmacy, correct? But where do we get them?
Well, BPC naturally is from our human stomach fluid. So it was isolated in like 1990s by a guy in Croatia, and he has published a lot in animal studies. Um, and some really phenomenal studies he's done was the classic one he did was he took I always want to say rabbit, but it wasn't a rabbit. It was a rat Achilles, and he completely severed the Achilles. And then he had another group of rats that he completely severed. the Achilles. So they had a group that they both had their Achilles severed, but half the group got BPC, the other half got the control, just basically saline. And he injected BPC
Mm,
in the, not even near the Achilles. And 1 month later, he was able to see complete resolution of the healing of the torn.
that's
Uh,
awesome.
so
And that was
what?
decades ago.
Yeah, 19, like I can't remember the publication, but yeah, it was like 20 plus years,
That's
or maybe
fascinating.
50. Yeah, so that's why a lot of athletes, they read that, and a lot of I just heard this. This is I haven't verified, but someone just told me I think the special forces are using it, but it's not FDA approved. So this is something that I'm trying to hopefully. There's a war on peptides with the FDA. I just got back from
Yeah.
Washington, D.C. This
I heard
tells
that you're trying to do some research to help save that and keep it going.
Yes, I am doing that too. And also, I just got back from Washington, D.C. on December 4th, and it was an unfair fight. But just kind of tell you a quick update on it. Um, that there was a lawsuit against the FDA, and the compound pharmacy is called Edexius, and they're in Texas, and they basically said, look, you're this is this is like enough is enough. You're violating all your even bylaws, and you're just like going crazy. You're not even following your own steps. So they actually went in front of the judge, and they decided to settle. And they said, okay, we'll discuss this at the FDA meeting on some peptides that was on that lawsuit. And so they had a meeting like end of October and December 4th. So I went to the December 4th meeting in front of the FDA, and it was not a fair meeting because of the loss, the settlement. They, the FDA had the upper hand. So it
Yeah.
was not an even discussion, and it was unfair. So they had 1 hour to discuss the evidence, which wasn't 100% correct. And because I read all the literature on thymosin alpha-1. And anyway, I asked for 30 minutes. They only gave me three.
Oh
Um,
man.
and it was like, how much can you talk in 3 minutes?
Yeah.
So anyway, the bottom line is that we got denied for that peptide, thymosin alpha-1, for it's called a bulk drug substance. And but the good news is there's a new administration coming in town,
I was
and
gonna say, I was like, yeah,
yeah, I mean he's RFK, uses peptides, and
yep,
we shall see what happens like by February, and maybe this nightmare will go away.
yeah.
But in the future, BPC, to save that, we really need to do clinical research. So I have two published papers on BPC. One's on knee pain, and one is on interstitial cystitis. So you can Google Scholar
Yep.
and type my name, or just say BPC for knee pain and BPC for
Yeah.
interstitial cystitis, and you should see
Nice.
the article there.
Yeah, I
But
think
I have a
starting
couple, I'm sorry, I have a couple IRB approved trials that I'm doing now. And
nice.
it's good. It takes time, it takes a lot of money. It's painful to do,
It
but
takes 10 to 15 years to put out a high quality randomized control trial, but even if you put out some case series and some lower level research and get the ball rolling, I don't know anyone else really doing it, at least around Florida yet, that are fighting for peptides and stuff like that. So, yeah, I think next year will be interesting to see what the new administration, whatever person's beliefs or thoughts are for RFK, but he's pro peptide, so it'll be a positive change in that. Hopefully, we'll see. Um, so just to clarify, are peptides from animals in the gastric juices, or is it human, or is it can you use animal peptides and put them in humans?
um, that's a loaded question. So the BPC 157 is derived from, it was discovered from human gastric fluid.
Hmm.
Uh, and but the way they make these BP, like these peptides, they need a peptide synthesizer. It depends how it's derived. Some of these amino acids are derived from animal source, others are from plant source. So it's a little confusing. You have a machine called a peptide synthesizer. You put amino acids on one end, and out comes a peptide.
Nice.
It takes
Okay.
30 days. It takes 30 days. It's not like it's like a microwave. You
Oh
push.
wow, it takes 30 days to form a peptide. Wow.
You
Okay.
got to clean it, and it takes time. It's not a fast process. So generally, the countries like India and China, they can make a lot of it. They have huge like peptide synthesizing machines, and they have vats of it. Then you have a middleman that gets it, and then eventually gets to FDA registered site, and if it's clean and all that, then it can be released. It does go through some testing, and you really want to get it through a compound pharmacy, through a 503A compound pharmacy. So you need a prescription
Mhm.
because they're checking for endotoxins. They're checking for basically, make sure it's the right thing. It's not, something that's sold on the internet. You don't know what you get on the internet.
Yeah.
So, I mean, the thing is that yes, you can buy peptides off the internet, but they're not safe. And I tell my patients, you can get that, but I wouldn't use it, and
Yeah.
because you don't know what you get. So I know they're out there, and there's no regulation, and so they always say, yeah, we have certificate analysis, but it's you can print out any piece of paper and say this is what we have. So I mean, it has to be third party verified, and even the FDA doesn't trust those things. They want to test it themselves.
Yeah.
So that's the whole thing is, I mean, how clean is it? And the thing is that it is generally made through basically through a peptide synthesizer.
Yeah.
I was hoping that the newer technology it'd be basically made in like with E. coli, and you just basically modify the E. coli and basically the bacteria, and it just basically produces the peptide. And then that's like called recombinant DNA therapy, and that's how growth hormones made and all that. But apparently it's too small.
Yeah.
It's not that big of a molecule, so I don't know why they don't do it, but with recombinant therapy. So.
So what other classifications of peptides are there? I mean, you have like BBC 157. I'm sorry if I mispronounce it, like cimarelin, and that class is a growth hormone increaser, right? What other tools or whatever mechanisms are they going with peptides besides those two?
That's interesting. No one ever asked me that. So in my book, I have 13 chapters and kind of go through like peptides make you younger, peptide for to help your sex drive, growth hormone like peptides, the healing peptide BPC, the tanning peptides.
There's
Pep
tanning. You said tanning peptides?
Yep, yep. That's yeah. That's FDA. Everything it's in my book. The FDA has
Yeah.
kind of and but anyway, there's Miracle Grow for the brain and protecting your DNA for your immune system. So I would say I only have what quote 13 or 13, 14, 13 chapters in my book, but the thing is to answer your question, there are probably hundreds.
Wow. So you also said younger. Does it actually like mess with the telomere length also, like genetic wise, or is it
Yeah.
just like healing and recovery?
No, there's a peptide. Called epitalon, Epitalon. And epitalon, when we give it injection wise, which is hard to get, I don't think I can get it anymore. I had a group of my patients that we measured their biological age, and everyone basically reduced their biological age. And I haven't looked at the telomere lengths, but apparently in Russia they did a study and it showed it increases the telomere length. Um, I don't want to complicate things, but you kind of asked the question about is it animal derived? So there are a whole classification called peptide bioregulators, which is pills. They're very small. There's only 3 to 4 amino acids, all developed in Russia. Those are animal derived. Those
Hmm.
are cows that are um, now they basically, I mean, you got to be careful where it's derived, I mean, where you get it from, but the ones that Dr. Cavison basically worked on, they was generally produced in Belgium. So
Hmm.
they use the organs from the cow and then get the peptides from that, and then you swallow it. So if you need better brain health, you swallow that. So the answer to your question initially, is it animal derived or non? The answer is it depends. So
Hmm.
peptide bioregulators are really kind of also the future. Not really talked about. And the difference between peptide bioregulators and peptides, this goes a little deep, is the peptide bioregulators are smaller. They're like generally 2 to 3 or 4 amino acids, and they can turn on your DNA to make to turn on your, let's say, protective genes or turn off your cancer genes.
I was
So
just about to say, I was like, wow, if you're going there, I was thinking cancer, but yeah, good.
yeah, whereas the bigger peptides like peptide BPC 157 and thymosin alpha 1, BPC 157 it's a 15 amino acid peptide, thymosin alpha 1 is like 28 amino acids. So it cannot get into the nucleus, but it can actually they ring the doorbell and they can basically do their effects, but it really we call it epigenetic effects. The
Hmm.
bioregulators turn on genes, turn off genes. That's what they do. Whereas peptides like rings the doorbell, and if you want better immune system, it can help that. If you want skin look better, it can do that. So but they work totally different. That's why we have a peptide class that we teach doctors. It's an 8 hour course, and we teach the basic.
Nice, nice. Let's get back on with BPC 1157. So, from my understanding, it kind of heals from a macro level and a micro level of an injury. Is there any like growth hormone regulation that's also affected by that? Or you already talked about like when you're injured, it helps prepare, helps heal with like fibroblast tissue and the whole recovery process. Is there any growth hormone that's involved with taking like BBC 157, or is it just with the healing process?
Well, they did a study to look at the mechanism of BPC 157, and so the thing is that it's been shown to that it increases the growth hormone receptors. So 3 days after stopping BPC, sorry, um, if I turn off this beeping sound, then you can't hear me. Uh, so 3 days after stopping BPC, it's you can still have high density of growth hormone receptor sites. So it also there's also another pathway that BPC works with that growth hormone pathway. It's called the FAX paxillin pathway. But anyway, it just generally helps if you give a little if you can get higher dose of growth hormone with BPC, you'll even heal faster.
Hmm, that's so good. Yeah. Nice. So a lot of things that you see online is the modes of taking it. What is the preferred way to take BBC 157? Is it injection versus oral? Do both of them work? Which one's better? What are your thoughts on that?
The short answer is injection is always better. If you can get to the site of injury, that's always the best. If you can get into the joint, if you have a joint issue, versus, sometimes people don't need joint injection if it's a muscle tear. Um, and anyway, like generally, if people come in, we either I inject or a colleague of mine injects. And after that, then we say the next day take the BPC pills. So we have the BPC pill with arginate, the original patent, and we ask them to take it one pill twice a day, and then after a month, maybe switch to one a day. But if your injury is healed, then you can stop. You don't have to take it. But I have people who've been on it for about 8 years, the pill, and they look younger every time I see them.
Nice. That's awesome. Yeah, because that's one thing I was like, So in rehab and with a lot of medicine, tissues that don't have good blood supply, like your cartilage, intervertebral disc, your meniscus, and I always wondered if, could you consume something orally and does it even get to that tissue? So does like BBC 157 work great for extracapsular injuries, muscles, tendons, ligaments, but does it still work really for those tissues that are intracapsular, like your meniscus, your ACL, your articular cartilage, your intervertebral disc? So you're saying that if someone has an intracapsular one, the injection is going to be the best bet for them, correct? Because you can get inside the capsule, inside the joint,
Right.
and it will still work intracapsularly, even though no blood's getting to that. That's fascinating stuff.
Yeah, I mean, today I had a patient that a friend of ours, my son, my two boys grew up with this. Anyway, he's coming from a really uh, prestigious school in California. He just flew in this morning, and he injured his knee playing football on mid-October, and then he had his surgery at a top hospital in California. And we were supposed to go skiing together in Switzerland, but since he had his knee operated, I don't think it's skiing. But
Yeah.
I just saw him in my office, and they're leaving tomorrow to Europe. And I said, "Let me inject you with BPC." So he had surgery like November 18th, so he's basically almost a month out. And his knee, he says we did ship him some BPC. He did his sub-Q injections near his injury, his basically on his left like thigh next to his knee. And he did 13 days of it and then switched to pills. And he says he's walking faster without crutches, with compared to his other people going back to the he sees in the waiting room because everyone had the same operation, about the same time. So, and there's less inflammation. So, I injected BPC into his, with also little TB4 intra-articular into his left knee. And I suspect that he's going to even recover faster with that. So,
Nice. Yeah. So you're gonna have what's interesting is like almost stem cells versus peptides going forward in regen medicine and stuff like that. I have a patient right now, he's a retired physician. He's like, yeah, in so many years we're going to be having computers and do this. I was like, you know what the future of orthopedics is? I was like, I guarantee you it's a combination of what I'm doing plus treating you systemically from inside, like stem cells, PRP, and peptides. And then he was like, what are peptides? And I started talking to him about it and stuff like that. But like, it sounds like there's gonna be competition. Like, what's better, peptide stem cells? Like,
yeah, we
peptides are
offer,
doing a lot.
yeah, we offer all three in my office. We offer like the start off with the peptides because it's the least expensive, and then stem cells is the medium price, and then exosomes are I think are the best. These are basically the avatars of the stem cells. So exosomes that's derived from the umbilical cord. Oh, they're probably 1,000 times faster in healing versus.
Wow. Like,
But
I know
but
people that,
the price is you pay like
yeah,
300 $400, or you pay 4,000.
yeah, I
So
know people that are going to Tijuana, Mexico to get stem cells, and they're getting stem cell injections and then stem cell injections again, and they come back and do rehab. And I'm seeing some change stuff. But man, if you're doing all three and that third one, what was the third one you said?
exosomes,
Exosomes.
EXOSOME.
Nice.
Yeah, exosomes are, I mean, my favorite. And umbilical cord tissue, mesenchymal stem cells release these exosomes. This is the problem with stem cells is you don't know if it's going to take. The
Yeah,
body could reject it, and the healing power of the stem cells, they release exosomes. So imagine they release peptides, but they're different. They can release peptides, but they release like microRNA to help heal you faster. Just rebuild circulation, your tissue. I mean, it's amazing what exosomes do.
nice. Is there
So
any precautions? Is there things that you're seeing that you have to screen patients for before you put them on peptides or something like BBC 1 157?
Yes. If you have you're undergoing active cancer therapy, let's say you got recently diagnosed with some unformed, some bad cancer and you're going chemo radiation. We don't we stop all regenerative peptides. But there are peptides for cancer. So
Yeah.
like I've treated my father who had stage 4 cancer and he basically was given actually not 9 months. He was given 1 month to live and they said they can't do anything and he had a blood cancer. So I came, he had a bowel obstruction at surgery. They found the cancer and they said it's a
Hmm.
T-cell lymphoma. And so they go surgery, chemo, actually chemo radiation won't work. So I gave him 4 different peptides and he went from a wheelchair to walking 1 mile every day, regained his
Mm.
weight. And we got 9 extra beautiful months with him. And then my mom got scared, thought the cancer was, you could see it growing. Went back to the oncologist. Oncologist was shocked, thought he was dead. And they go, well, why don't we try radiation? And it's like, I wasn't there at the meeting, but it's like, you
Yeah.
just in December, this isn't going to work. And that
Mm.
just opened up the surgical wound, and he
Jeez.
passed away quickly after that. But the thing is that we don't live forever. That's part of life. But the
Yeah.
thing is, um, anyway, there are peptides that can actually help as adjuvant therapy. It's not really
Hmm.
the primary therapy, but
Is there any side effects of BBC 157? I mean, I know that some people complain of a stomach ache sometimes, but are there any side effects?
well, sometimes it depends on the buffer that they use in the solution, and they may be allergic to that, but by itself, BPC is safe. Uh, so I mean, I've seen one with a rash, but I think she was allergic. After that, she basically, it's like she wants to take peptides, but I think it was really that there's something in the preservative that she was sensitive to.
Yeah. What current research are you doing right now?
Great question. So I have a ongoing study with an orthopedic surgeon, and he has basically for knee surgery, it's every other person who consents to do this study will get the peptide BPC at the very end of the surgery before closure. And they will follow up for several months to see how their recovery is. And then he's also doing shoulder surgery too. So just not only knee, but shoulder. So it just before he pulls the laparoscope out, he injects the BPC into the joint and
Yeah.
then
I
follow-ups.
mean, Aaron Rodgers, I'm sure you heard of that case where he tore his Achilles last year, the NFL quarterback. He
Yeah.
ended up coming out afterwards and saying that he was on peptides and he recovered so fast and was able to run at like 6 months. So it's like these musculoskeletal injuries that used to end people's careers now, they're returning in six months to 12 weeks ish and going back and running already. It's fascinating stuff because that's where my brain goes next is wow, how is anyone doing this combining orthopedic rehab or orthopedic treatment for musculoskeletal injuries in combo with this? I don't know anyone doing it yet, but that's where my brain goes. I could get
Well,
patients better so much faster.
I think there are some football programs. I heard Nick Saban um, really does not want their players to undergo the knife because they don't recover and they're not the same afterwards. So I have never confirmed it, but I've heard that he is a proponent for regenerative medicine. So, and I heard a lot of professional players use a lot of peptides and stem cells, not stem cells, exosomes, um, especially the NFL. So that's
Yeah.
what I've,
I
no.
mean, I have colleagues that are working with regen medicine physicians already, and they'll take someone who has a labral tear and they'll do stem cells plus PRP injections. And with rehab, they're able to heal it and prevent surgery needed and get function and everything back. And that's why, I mean, like, this is the next step of where a lot of orthopedics are going to go. The combination of these three things plus standard care, we could be getting people better faster. And even to the average person that has like a calf strain or these common musculoskeletal injuries, if you combine PT, solving the root cause, plus put them on exosomes or
Right.
even like
Yeah.
peptides, that's the
So
future.
so you get it. Yeah, it's a no-brainer, and it's just that I think we're hopefully the new administration will continue to let us use some natural peptides. So yeah, I've been losing a lot of sleep because of this war on peptides, but I have another study that I'm doing, and that is it's in several clinics. So the FDA really wants a follow-up on safety and efficacy, so they don't trust the doctors filling out the forms. So when a patient consents in my office to do it, to be in this 1 month study, everything's on their phone. There's a QR code, there's a questionnaire, and they get asked the same questions 2 weeks at baseline, 2 weeks, and 1 month after injection. And it'll be collected and it'll be independently reviewed and all that.
Hmm.
So it took me a lot of money and over probably a year and a half to get that study I mean, to get going. So I have several different clinics that use a lot of peptides that are really excited to be in this study, to be a study
Nice.
site.
Yeah,
We
you have to team up with someone locally, like get team up with a professor, a statistician at UCF, so they can do all the stats and the write up and everything, and you just do the clinical work and team up. That's what we've done in the past. When we have a publication, I'll team up with a UCF professor and let them. I'll do the data collection and the lit review, but they can do the write up and all the stats and team up with someone
yeah,
else to do that.
generally I do it all.
Do you
So
really? That's impressive.
Uh, and well, I'm not a great writer, but I have a team of people to correct my poor
Nice.
grammar. But
Yeah.
anyway, um, but
Is there
yeah, I
anything?
mean, the thing is, it's yeah, it's that's great that you can do it that way. But anyway, yeah, it's I don't mind sitting down and writing the paper. So.
Yeah. So is there anything that you find that peptides or BPC 157 doesn't work on? Like, has it not worked poorly on certain cases, certain diagnoses, or like autoimmune disease? Or is there anything that it doesn't work on?
Well, BPC will not touch autoimmune. It's not going to reverse. Uh, I mean, if you have a cataract or a big prostate, I mean, it's not going to. I mean, it will. It's primarily musculoskeletal. It can help you look a little younger with turning on the fibroblast cells for your collagen. It helps heal ulcers and fistulas. But it can help heal leaky gut, but it's not gonna basically
Well, how
turn
about like heart
bad. But
disease? Does it help restore like endothelial or even heart disease? Anything like
no,
that?
it can help with some circulation, but I don't think it's the major thing with that. There are other anyway, but it's interesting. Um, yeah, there is a kind of a product that I like that's not a peptide to help with endothelial function. But this is the product called Arterial Sil. I have it right here. I take
Hmm.
it Arteriosil. And anyway, it has a special Japanese seaweed that's been shown to improve the endothelial glycocalyx. And I have a lot of my patients take that.
Nice.
Uh, it's not a peptide, but
Yeah.
um,
So what type of
it,
patients and diagnoses do you primarily see at your office? Is it orthopedic slash youth
I have
getting younger,
I have
all
a
of the above?
wide range of surprises that come to see me. Um, actually, I have some ALS, difficult patients there, Parkinson's. I have early demented patients that are really doing phenomenal. We're doing something called therapeutic plasma exchange, removing the bad stuff out of their plasma. Um, I mean, I have patients that just want to be healthy, get off some of the medicines. So they just don't want to be on pharmaceuticals.
Yeah.
And sometimes I can reduce some of them. Some like, I'm few, I can reduce all of it. But yeah, there are some difficult patients I have, but some challenging ones. I can't fix everything, but I'm trying.
Yeah.
I mean, always learning. I don't know
That's
everything.
awesome. I think you're doing some really innovative stuff, and this is some really cool stuff. I look forward to meeting you in person, talking on this, and kind of seeing what the future is regarding orthopedics slash rehab, and if peptides is that future, if not some of the
Let,
other
let me
things.
tell
So
you a funny story about I was at a meeting at Dr. Mark Gordon's. I was teaching peptides in his traumatic brain injury. And I actually now Mark Gordon uses peptides, but because the class that, well, the lecture I did kind of helped him learn all these peptides. But there was a retired, let's say, colonel from the United States Air Force. He was an orthopedic surgeon, and he was in the back of the class. I was talking about some peptides helping the brain work better, and I kind of went off tangent. I talked about musculoskeletal issues and how how I helped heal ACL tears and shoulder issues and rotator cuff. And he got up and pointed his finger in my face. He says, "Damn you, you are going to ruin the careers of orthopedic surgeons." He was really serious about it. And it's look, I think orthopedic surgeons should learn
yeah,
these peptides and give it as an option rather than just give them steroids. I mean, it's just steroids, and if that doesn't work, it's like, okay, let's do surgery. Give them an option of, like we talk about simple things, peptides. You can offer exosomes, and if that doesn't work, then surgery. Surgery will always be there. I
yeah,
mean, people will always need surgery, and the thing is that I think people would love their orthopedic surgeon to offer something more than just steroids.
I agree. Doing what's best for the patient, and not even that, can you get him even better faster? That's a
Exactly.
huge option right there. So I mean, it's doing what's best for them. So
Who wants to be sick, and disabled
yeah,
for a
yeah.
long time?
Well, perfect. I mean, all this stuff was great stuff. I know that you have to go. A, we got the Fab Five questions really quick, and then I'll get you out of here. So the Fab Five questions. What is your favorite restaurant in Orlando?
Oh, that's a tough question. So I'll just say at the top of my head, um, oh, mhm. There is the Dragonfly, because I love their miso cod. That's generally in their crab fried rice. So that's
Yep.
Dragonfly.
Nice. There you go. That's off of Restaurant Road down in Dr. Phillips, right?
Yes, on yeah, Salmon Lake Road.
Yeah.
Yes.
Okay. What book are you reading right now?
Oh, interesting. I have it right here. I'm tutoring my son. I'm saying, hey, why don't you consider this is it's kind of a cartoon book about biology, and it's two women. They have some great YouTube videos, and it's not college level, but I just wanted him to kind of get the basic steps. So I'm quickly going through that one.
Yeah.
And
What is what's your favorite supplement that you're on right now? Probably say peptides or BBC 157.
I think no, actually epithalin, Epithalon. Yes, I use epithalin. That's my favorite peptide.
Nice. That's good because I'm trying to, my family has a bad history of heart disease and diabetes, so I'm trying to prevent it. But I've been put onto the like cocoa and cocoflavanols and looking into some of that stuff too right now. So, two more. How many hours of sleep do you get a night?
About 8.
I'm a 6 to 8er. As long as I get between 6 to 8, I'm doing good. I'm functioning good. Good quality sleep. If I start getting like 4 to 5, I start dragging by Friday. So I'm a six to
Well,
eighter
well,
also.
Saturday morning I may be up at 5 for a bicycle ride, and I may do 80 to 100 miles. So, but then I'll take a nap afterwards. But generally, days I get 8 hours of sleep. It's just that
Perfect.
the roads are quieter, less traffic.
Yep. I'm a morning guy too. So, what's one thing that you would go back in time and tell your 20-year-old self?
On myself.
Yep.
Since it's on podcast, I better not say it. But anyways, maybe at the bar when we meet, I'll say it. But uh, oh, let's see, instead of going to medical school, just become a landlord and build a nice commercial building so
Oh, there
doc,
you go.
you don't have to work so hard.
Yeah.
Kill yourself.
It is very interesting. The common answer is about finance, of some sort of finance, because we were not taught finance or managing money or investments at all in school in undergrad, nor even like PT school. So that's a very common answer. It's some sort of finance stuff. So anyway, perfect. I know that you have to go. Thank you again for taking time out of your day. Much appreciated. We will be in touch, and thanks
Oh,
for talking some peptides with me.
sure. Take care, Ron.
Perfect. Yep, you too. We'll see you.
See you. Bye bye.